Good afternoon, everybody. It's such an honor to be with you today. My name is Tony Sanders. I'm honored to serve as the State Superintendent of Education. We can't thank you enough for spending your afternoon with us here today, especially on a Halloween, probably a day that's been pretty filled for all of you with a bunch of kids hyped up on candy maybe today. If I remember my time in school districts appropriately, today is a very busy day, I'm sure, for all of you. So we really appreciate that you're taking time out of your schedules to join us here today. Thank you for joining us again for this Beacon Overview webinar. We're grateful for your continued commitment to improving behavioral and mental health support for Illinois children and families. No one has a deeper understanding of the frustration felt by families seeking mental or behavioral health services for a child in distress than you do. You know how a lack of coordination and communication between agencies combined with difficult to navigate systems can delay a child's access to vital resources. Yet through it all, you continue to serve as advocates and strong supporters for your students and, of course, your families. If you weren't aware, Governor Pritzker launched the Children's Behavioral Health Transformation Initiative in February of 2022. In fact, when I first took this job a little over a year and a half ago, my very first press conference was with Dana Weiner, our special guest speaker today, where we talked about this Children's Behavioral Health Transformation. It's powerful work. There's a lot of exciting projects coming out of this initiative, all aimed at adjusting capacity, streamlining access, and supporting earlier intervention to prevent acute crises for children. One piece of this work is the new portal called Beacon. And you all, as school social workers, school counselors, and special education administrators, are being invited as early users of this portal before it launches to the public in 2025. This new state-of-the-art online portal is powered by Google AI and cloud computing technology, and it'll play a crucial role in improving how families and providers find and coordinate care. Beacon has the potential to change and save lives. I encourage every school counselor, school social worker, and special education administrator to use this tool over the next few months and to provide us your feedback directly through the platform's feedback form. Your input on this is vital to our continued success, and it'll help us improve the platform to better serve Illinois families. Here to tell you about the Beacon and how it can help you and your students is the amazing Dr. Dana Weiner. If you're not familiar with Dr. Weiner, you should be. She's truly a rock star. She's the Chief Officer for Children's Behavioral Health Transformation and a Senior Policy Fellow at the Policy Research Center at Chapin Hall. Dr. Weiner is an expert in child welfare. She served for 6 years as a Senior Policy Advisor to the Director of the Illinois Department of Children and Family Services, as well as an Evaluation Liaison for the Permanency Innovations Initiative. In 2011, she was appointed by Illinois Governor Pat Quinn to serve on the Illinois Juvenile Justice Commission. In 2013, she was appointed to serve on the Child and Family Services Advisory Council. Dr. Weiner is not only a leader, she's also a teacher. She teaches data for policy analysis and management courses at master's level students at the University of Chicago's School of Social Work. She's also taught doctoral level courses in research methods and statistics at Northwestern, and she obtained her PhD in clinical psychology from Northwestern in 1999. So I'm honored to introduce Dr. Weiner. I'm proud to call you a friend, and with that, I'll hand it over to you, Dana. Thank you for being here with us.
Thank you for that kind introduction and for pulling together so many people today. There's over 570 of you in this virtual room. I'm thrilled to be here with you. And I just also want to echo Superintendent Sanders' gratitude to you. You really all are the front line in our efforts to improve the lives of kids who are struggling with behavioral and mental health challenges. Many of you are the constants in their lives and the people they see every day. And so I'm hoping that you receive this new tool, Beacon, as an assist for the hard work that you're doing. And I'm really happy to be here today to tell you about it. So I'm going to give you a little bit more background about my role and what I'm doing here, and then we'll get right into how Beacon may be able to help you help kids who are struggling. So as Superintendent Sanders said, coming out of the pandemic, with concern for the rise in youth mental health problems and the diminished workforce to address those needs, the governor's office asked for a comprehensive review of our children's behavioral health service system, focused on closing gaps and making sure that families could access the services they need without unnecessarily becoming involved in some of our state systems like child welfare or juvenile justice. So Beacon, what we're talking about today, is a core component of the Children's Behavioral Health Transformation Initiative. And if any of you have seen the blueprint for transformation, if not, happy to provide the link to it, you'll note that it's recommendation 1 is a centralized care portal for families to be able to have a single place to go when they need to find services for young people. And that's what we're going to be talking about today. But I'll just say another word about the priorities or values that are driving our work in transforming children's behavioral health. And I should also mention that this involves 6 state agencies. Illinois State Board of Education is one of the 6. The others include DCFS that we mentioned, the Department of Juvenile Justice, HFS, the State Medicaid Agency, the Department of Human Services, and the Department of Public Health. So all of those agencies are working together to try to improve families' experience of seeking services. And we're really driven by these 4 priorities. 1, to simplify things for families, to absorb the complexity behind the scenes and make it easier for families to see what's available and to access it. 2, to leverage powerful technology to improve efficiency and transparency and to free up the humans to help the humans who need help, as opposed to spending lots of time searching for things. We can use the technology to help us with that. The 3rd priority is listening. We've really tried to elevate the voices of consumers, and much of what you'll see today in the functionality of Beacon is a reflection of what parents said they need in a system that would help them. And then the 4th priority is promoting the interagency collaboration. Historically, some of you may have observed it's been very hard for the state agencies to work together, either because of legal barriers or because of technological systems that don't talk to each other. And we've really demonstrated that we can overcome a lot of those barriers with the systems that we've put in place. You're going to hear more about that. So the blueprint has 12 strategies in it. Those 12 strategies are listed across the top of this grid. And our 5 goals for improving our system are down the side: to adjust capacity so we have enough of the services we need, to make services more accessible, to allow us to intervene earlier to avert serious problems, and to develop agility and accountability as a state in our dealings with the private service providers. The only reason I'm putting this grid up is so that you can see how much work is going on in so many different areas. There are lots of different activities and they all work in conjunction with each other. So what I'm going to show you today, Beacon, is just one piece of this puzzle. It's the first one, Care Portal, but it doesn't work without all these other pieces, and work is underway to get them all in place. But what we're focused on today is Beacon, which is an important piece of the puzzle. I like to describe Beacon as a routing application. Beacon connects families with people, human beings, who can help them to find the things they need. And Beacon allows everyone to see what's available for young people based on eligibility. There are, as I mentioned, there are other developments underway, including a statewide resource referral tool, which we don't have yet. We have a placeholder for it that you can link to through Beacon, but I envision a world where every one of you has on your smartphone a statewide resource referral tool that works like OpenTable, where you can make an appointment for a young person. We don't have that today. That's not what Beacon does. What Beacon does is it brings everybody in through one door. It identifies what the appropriate services are. It connects them to people who can help them navigate, and it can offer them the opportunity to have navigational assistance. Beacon does not diagnose anyone. It doesn't prescribe services, and it can't make appointments, but it can get people to where they need to go. So we developed Beacon because we heard from many families that the pathway to accessing services, particularly services for complex needs like residential treatment, was like navigating a dark, unmarked forest, and that what you got depended on what doorway you came in. And the paths here are marked by the 5 agencies that could help a young person obtain residential treatment. So we created Beacon in order to help families more easily find and connect to the right services, using technology to streamline communication and reduce delays, providing tools for tracking progress so that everyone can see why they're waiting, if they're waiting, and possibly most importantly, to create a shared platform so the state agencies could work together to quickly pass the ball to each other to make sure that families get what they need for their kids fast. So we've gone from this picture to this picture, where no matter which doorway you come in, you are met with a helper, a guide, and a set of options that are calibrated to what the child's needs are. So I said Beacon is a routing application. It connects families to services through a single place. The more information that's provided about the young person, the more Beacon can match and suggest state-funded services. And it lets the families, it coordinates among the state agencies. But I mentioned that we heard a lot of feedback from families about what they wanted this system to do, and we built it accordingly. Some of those things that we heard were parents told us they wanted to be able to set up an account in a website where they could upload documents like the IEP, like potentially hospital records or psychological evaluation, so that they didn't have to go finding those documents and scanning them or faxing them, but they would all live in one place. And if someone from a state program asked for them, they could go and find them. So that's how we built Beacon. We built it with the ability for parents to set up an account, to upload documents, to request assistance from a navigator, and all of that depends on parents or caregivers giving consent. So I'll say a few more words about Beacon, then I'll show you how to use it. Why do we think Beacon is going to help improve our system? One, because it will help provide families with access to services. We heard from parents it was very, very hard to figure out what things their child was eligible for. And it took a lot of searching in a lot of different places. This puts them all in one place. And what's running in the background is something we call a master eligibility algorithm, but it took a lot of work to pull together the eligibility criteria for every state-funded program. But that's what's running in the background, as well as the SPIDER database that DCFS maintains, which is a comprehensive database of community-based services. So we also think Beacon will help by coordinating care across agencies, by empowering families to be active participants and advocates on behalf of their kids. And by reducing barriers, we hope it will reduce stress for families and improve quality of life. But I mentioned that this depends on families giving consent for their information to be included in Beacon. And so let me talk a little bit about the ethical considerations. So as Superintendent Sanders mentioned, this tool was built by Google. It's owned by the state of Illinois. Google doesn't have any access to the data that goes in or the information on families that go into Beacon. And that information sits in an encrypted, secure, cloud-based platform. Beacon ensures that all family and child data is handled securely and in compliance with privacy laws. And families are asked to give consent in order for their information to be shared with the state agencies that operate the programs they're looking for. Now, families don't have to create an account. They don't have to give consent. But if they do give consent, that lets all of the agencies see their documents and act quickly to try to secure the services that are needed. Rest assured that we negotiated this consent form in all of our processes with the attorneys at the 6 agencies I mentioned. So no less than 12 lawyers have had a look at the informed consent form and all of our business processes. All right, so Superintendent Sanders also mentioned that you all are early users of this tool. I announced this project with the governor in January, the end of January of 2024. And on August 15th of 2024, as promised, this Beacon tool went live. I should also mention it's based on a test version of a portal that we built very early on and used for 2 years on 440 cases. And so we had a test that demonstrated that this works, that it works to speed responses to families, that it works to overcome barriers to collaborating, and it works to get kids services. And we have a number of testimonials now of people who had a really, truly different experience because of the existence of a centralized portal. So in August, we released it for use with our interagency team. That's the team that meets every Friday morning to help expedite services for kids who are stuck in psychiatric hospitalization. Those people were very practiced at using the previous portal, so they jumped right in on August 15th, and we gave them about 6 weeks. to surface and iron out wrinkles in this system so that then we could release it to you with a little bit more confidence that it would do exactly what we were promising that it does. We don't have any concerns about the technology really, but the process of practicing throwing the ball to each other and not having anything fall through the cracks is the thing that we really want to iron out before we release it to the public in January. So you all are part of our phase 2 release, and I'm thrilled to see so many of you on the line today. I encourage all of you to go to Beacon and check it out. This is how you do that. So you can see listed on the right the URL to get there. What you can do when you get there is you could create an account, and you could do that on behalf of the family, but you would have to tell the family then that somebody would be reaching out to them to obtain consent. Or you can tell a family how to do it, or you could do it sitting next to them and create an account with them there, and they could give consent. You can also use Beacon anonymously. You don't have to enter any identifying information, and you can search around for services in Beacon. But as I said, the more information you give it, the more it can provide. I should also go back to my routing metaphor and point out that if you come to Beacon and you're in crisis, it will redirect you to our state's crisis resources. If you come to Beacon and you are older than 18 years old, it will direct you to adult services. If you come to Beacon and you're working on behalf of a young child, it will direct you to early childhood resources. So in that sense, it gets every place where they need to go. So we do recommend that parents or guardians log in to create an account prior to getting started, because it will make it easier to check on the status of requests. And it will also put the young person's information into the queue for one of our resource coordinators. The team of people who staff Beacon work at the Division of Mental Health in the Department of Human Services, and they were hired solely for the purpose of responding to the needs that arise through Beacon. 3 of them are resource coordinators, so they see what comes into the queue from the previous day, and they prioritize cases and they reach out to families. 5 of them are clinical specialists in specific areas that we learn through our 2-year test need specialized attention. Those are kids who have aggressive behavior, kids with developmental disabilities, kids with internalizing problems like depression and anxiety, and a few others. And we'll be hiring one actually for youth who are transitioning to the adult system. So you can create an account when you get to Beacon, but anyone can use Beacon. As I mentioned, you don't have to create an account. If you don't share information, you can still access lists of community-based services. And on the left, you can see here some of the tools that you can access through Beacon. So hopefully you're starting to see how it makes sense to have a single doorway for families to come in that then branches off to wherever they need to go, as opposed to searching all night for all of these things and accessing them separately. But if you're comfortable sharing a little bit of information about the young person, Beacon can provide a list of the state-funded services for which the young person might be eligible. You can also, and this again was something we heard from families, you can also request additional assistance from the Beacon team if you need more help. And here I've displayed the screenshots for, you can see at the bottom of the screen when you go to next step, you're asked, do you need more assistance? And if you do, then somebody will reach out to the family. And this is a big improvement. Most people who've used Beacon in the window since it's been live have said, I've never before gotten a person, and someone called me back the next day. So that's a big improvement. As I mentioned, Beacon routes people to the place where they need to go. So if crisis resources are what is needed, Beacon will send people to the state's resources, the 988 line, or CARES for mobile crisis assessment, or 911 if that's what's needed. So let's talk a little bit, just to make this more real and concrete for you all, how we envision school-based professionals like all of you would use Beacon. So here are some ways on these bullets. 1, identifying services for behavioral health needs in students. So teachers, counselors, and social workers can use Beacon to find services for kids who need more than what the school can provide. They can use it to refer families to appropriate resources, either community-based resources or state-funded resources. We think it can also support you as you are serving kids who have individualized education plans, because some of these kids require alternative educational environments or other more intensive services where a connection to the interagency team can be helpful. Behind the scenes, as I mentioned, there's a group of people who work together every Friday and really all week long to try to make sure that nobody is stuck in the hospital, in their parents' home, without appropriate housing, that we make sure we expedite services for those kids. And this can put you in touch with that team. It can also help you collaborate with families by creating a place where school staff and families can track the status of referrals. So this is kind of the same set of messages, but from the parents' perspective, how parents and guardians can use Beacon. They can use it to identify behavioral health services for the child in their care. They can create a case in Beacon to get immediate support. They can track progress and engage with providers through Beacon, and they can get updates on the status of their requests. So I'm just going to talk through two vignettes here, again, just in the interest of making this a little bit more concrete for all of you. The first, and these are stories from the 440 cases that we've already staffed in this way. So the names have been changed and some of the details have been changed, but these are cases that we helped using Beacon. The first is Amelia. Amelia is a 14-year-old who's diagnosed with ADHD, depression, and anxiety, and who was hospitalized after a suicide attempt. But she had also been implicated for aggression toward a younger sibling. And the hospital social worker entered Amelia's information into the portal to assist the family with finding residential treatment after discharge from the hospital, because her grandparents felt they could not take her back into their home because of concerns about her aggressive behavior. So prior to entry into Beacon, this family was not connected to supportive services, but once being entered into Beacon, a clinical specialist worked with the family to enroll Amelia in a few different programs: Pathways, the Family Support Program, and Interim Relief. Those are all funded by HFS, the state Medicaid agency. And also the clinical specialist was able to arrange the completion of an IM-CANS to qualify Amelia for the program that she was ultimately eligible for. And the Family Support Program was successfully able to find a residential placement for this youth, and she was discharged from the hospital and went to residential treatment. So I'll talk you through one more story of another young person, and then soon we'll have an opportunity to answer your questions. Eric is a 15-year-old male with a history of behavioral health challenges who became involved with juvenile justice. You may or may not be familiar with the CCBYS program. That's a program operated by the Department of Human Services. It's meant to provide wraparound style services for young people who are at risk of juvenile justice or child welfare involvement. And CCBYS entered the youth information into Beacon after his mom expressed that she did not want him returning to her home. She wanted him to be in a residential placement, but no applications had been initiated on the part of this family. The Beacon Resource Coordinator worked in partnership with CCBYS, sorry for all the acronyms, the CCSO, that's an agency that operates the Pathways program out of HFS, and the family to enroll the youth in Medicaid, find a safe place for the youth to reside with a relative, and complete applications for the Family Support Program and the Interim Relief Program. The Beacon Resource Coordinator continued to provide the relative guardian with lists of local services for Eric and the family connected to those services. And now they're no longer seeking residential treatment. They felt that with all of the support, they could maintain Eric in their home, in the relative's home. So this was another Beacon success story. So I'm going to just end with a few tips for maximizing the value of Beacon for you, and then we'll have some time for questions. If you're searching for information on behalf of a family, make sure you provide them with the list of services that you get from Beacon. So if you get a list that comes from Spider or Find Help, make sure you give the family that list. If you are requesting additional assistance on behalf of a family, make sure you let them know that a resource coordinator will reach out to them, because that is what will happen. And if they don't know because you didn't tell them that you entered their information in Beacon, they might be a little bit confused or not respond to the resource coordinator. So please let them know that what will happen next is that a resource coordinator from DMH, the Division of Mental Health, will be reaching out to them. And then also, Remind the family that we need their permission to share their information with anyone. If they don't provide consent, we can't put the ball in motion to reach out to them or to work with their, we can reach out to them to get consent, but we can't begin sharing information. And if the family needs help submitting consent, the Beacon Resource Coordinator can help them. So just a few more things to say, and then I will pause for questions. We are hard at work on all 12 of the strategies in the blueprint, and I've only talked about one of them today, but there's a lot more work going on. New features and enhancements will be added to Beacon based on feedback from families and providers, and we already have a list of things that people would like to work differently. That's partly why we're doing this slow, methodical rollout in phases, because we want to make sure we are able to detect any inefficiencies and get feedback from people. Beacon will also continue to expand the services that are contained in it so that we can ensure a broader range of options. And we'll continue to update it regularly to make sure it stays responsive. And those updates will include installing new components when they're available. So I mentioned that we envision building a statewide resource referral tool that can make referrals, that can let you make appointments. That's not going to be ready for, if I had to guess, I'd say at least 12 to 18 months. But in the meantime, Beacon works just fine, and we have these other pieces in place, but we are continuing to work toward installing other components. And that might even include making benefit enrollment more accessible through the Beacon doorway. That's something we're considering too. So I think now is the time. I'm going to pause for questions. So I think, Jackie, are you looking at the questions?
It's Natalie. I am going to. So we have the first question is asking, is there a link to access this PowerPoint?
That, I think, is a question for ISBE. I'm happy to make this PowerPoint available, and I know that a version of it will live on our website, the CBHTI website, which is the Children's Behavioral Health Transformation Initiative website. Is that the right answer, Natalie?
I believe so, yes.
Okay. I think that's the best place to get these slides, but if there's a way to communicate with the participants of this webinar, happy to send the link to the website out to the participants.
And I was just going to say, I think we have a way to either send it out, or if you don't mind sharing it with us, put it on our ISBE website as well for people.
Yes, I just got an update. Thank you, Tony, that we will be sending the recording and the slides out to participants. All right, the next question is, will this program be available to all youth regardless of income and insurance status?
Yes, that's a good question. So anybody can use Beacon, but I will say that when youth are covered by private insurance, it may be advantageous for families to consult the insurance providers network to maximize the benefits that they have. So Beacon was developed with the youth who are being served publicly in mind, and the vast majority of the youth that we have worked with are eligible for those public benefits. But we've also worked with youth who have private insurance, and that's not a problem. Families can absolutely find a lot of stuff in Beacon that takes private insurance. We just also, they'll get a message saying, like, make sure to check with your insurance provider's network so that we're not usurping that or trying to provide something when something else would be covered.
Okay. Next question is, will there be a brochure that we can provide to families? Also, do you anticipate this will be one of the documents that special education teams, LEAs, will need to provide at meetings?
That is a great idea. I love talking to all of you who do this work because you come up with good ideas. We just finalized a flyer, but in our meeting yesterday about the flyer, we all agreed that we would like something a little more family friendly to distribute directly to families, like fewer words, a little bit more inviting. The flyer is really geared toward like all of you, but you could hand it to a family. There's nothing that wouldn't be helpful about it. So we're working on the brochure, and I think that's a great question of whether, and the only reason I'm hesitating is because I don't know and defer to Superintendent Sanders about like how the rules about what you provide in an IEP change. I can say as a parent of a young person who had an IEP for many years, I remember the reams of things that were given to me. And so I don't know what is involved with requiring that a Beacon brochure go into those documents, but we could certainly explore it if you all think it would be helpful.
Yeah, we'd want to involve our special ed team to make sure that was appropriate, but we can follow up on that recommendation.
Great idea.
Okay, Dr. Weiner, thank you for presenting this tool. This seems to have some of the same features as Referral GPS.
So was that a comment from someone?
That was a comment, yes.
Yeah, so Referral GPS is one of the tools that we really tried to do our homework in figuring out what we needed to develop. And in doing so, we engaged a team of researchers who created an inventory of every kind of tool that's in use in any school district, including IRIS, Find Help, 211, Referral GPS, all of these tools, because I really don't want to reinvent the wheel or tell anyone they have to stop using something that's helpful to them. So when a few slides ago, you saw that if someone's looking for community-based resources, they are given the option to click on the different tools that may be in use in their area. We were able to do that for some tools and not for others, depending on whether they are proprietary or licensed. And I know you weren't asking specifically about linkage with Referral GPS. I am aware of it, and I would encourage, I think everyone should use the tools that are helpful. Beacon was really meant to be like a master routing application that might send someone to a Referral GPS in certain cases. And we linked to the ones that we could link to.
Okay, next question. How do you navigate it without putting information about the child? Explore anonymously. It takes you to a page with a list of resources, but it doesn't really allow you to explore beyond the list of resources.
So if you click on some of the listed resources, like if you're on the page that I was displaying where you can see Spider, for example, if you click on Spider, you can search for anything without entering a child's information. You could say, I want to know in zip code 60637 if anyone is providing in-home counseling for families dealing with, or you could look for evidence-based treatment for trauma or whatever in Spider. And so I think that's what we mean when we say you can browse for things without entering information through some of those links. I would just reiterate that you can do more if you enter information, but you don't have to. I would encourage you to check out the link to Spider because that's probably the place with the most information that you can get to anonymously.
Okay, next question. Is Beacon only available for people under 18? Is there a program that provides recommendations and resources to someone over 18?
Yeah, so Beacon will actually work with young people between the ages of 18 and 21 as well. And we do also work, we have work groups who are focused on the needs of kids who are aging out of the child system into the adult system, because we recognize that that's a point of real vulnerability where things in those transitions don't always go as smoothly as we would like. So we have a lot of attention focused on that. That said, when building this system for this iteration, we had to draw the line somewhere. So if people come in who are adults, we try to direct them to services for adults and not try to, because it would overwhelm our case management capacity if we were serving adults and kids with the current team that we have. That said, I've been talking to a lot of people, leaders in our state, at other state departments about, is this a model that we might just want to adopt across the board to make it even easier? And then you could go there to enroll in benefits, or you could go there for aging services, or, everybody wants to have a tool like this. So the idea of maybe expanding and building on this one as opposed to building separate ones, it is being discussed. Yeah, I would just say if you come to Beacon and you're older than the age that can be served through Beacon, you will be directed to some resources, but and you may also be directed to the interagency team that can address the needs of transition age youth. And there is actually a clinical specialist on the team, or will be soon, who's focused on the needs of transition age youth.
Okay, next question. Will there be mandates for a universal screener in schools that can help teams identify students with mental health needs?
Someday there will be. So recommendation 9 in the blueprint is to work toward universal screening for behavioral health problems in schools. What I will say is that we have been partnering with ISB since the beginning of this to slowly build a foundation so that we would be able to do that in a way that would be culturally sensitive and private and supported by policy and necessary resources. And I'll just say a word about it. The first thing we did is we conducted a landscape scan to find out what you all are already doing. And much to it was a pleasant surprise. We learned that 2/3 of school districts across Illinois are already screening young people for behavioral health problems, and 28% of your school districts, are doing universal behavioral health screening. So then we took a step back and said, oh, if so many districts are already doing this, what can we learn from them? What size team do you need? What policies do you need in place? What tools do you need? What training? What tech? And we turned all of those questions into a readiness assessment for a readiness scan. That readiness scan is open now. It's been sent to all of your school districts. If you are the recipient of it, I encourage you to answer the questions because that will help us design a phased approach to rolling out universal screening. I want to say one more thing about the mandate, and that is the mandate is not that every student must be screened. The mandate is that every district must offer screening to students. Students will always be able to opt out of those screenings if people don't want to be screened. But just as we screen kids for hearing problems and vision problems, because it's hard to learn if you can't hear and you can't see, it's also hard to learn if you're struggling with trauma, anxiety, depression, or other problems. So we will be working toward that, but I anticipate we won't get there till the end of 2026.
Okay. Is this an app or only accessible on the website?
It is my understanding is it is a mobile-enabled website. It is not an app, which means that you could access it from a mobile device, and it will look normal, and you'll be able to use it. But it's not an app that you can purchase in the App Store and use. It is not today. I will say the tool that we want to procure for the resource referral tool, I want it to be an app that is on your phone that works like an app. But that is not this.
Okay, next question. What kind of translation services are available?
Great question. I hope I can remember the 6 languages. So Beacon is translated into 6 languages. And there were lots of debates about which 6, because believe it or not, each state agency and the governor's office have their own separate list of the top 6 languages that things should be translated into. So we had to make some compromises, and I don't want to misspeak. I know that it's translated into, I believe it's English, Spanish, Polish, Mandarin. So it is translated into 6 languages, and an output can be received in those languages. The only problem is that the team at DMH that will reach out to families, they don't speak all of those languages. So while we can provide the technological assistance in other languages, we don't yet have the staffed capacity we do in some cases with some of those languages, but we don't have staff that speak all of those languages.
Okay, next question. Will there be interpreter services?
So most of the agencies have interpreter services, and we have leveraged the different agencies' interpreter services for individual instances. And I know at least one of my team members who's on this call today is probably thinking in response to these questions about what else we might do for interpretive services. And hold on one second. She's actually, DMH, thank you, Louisa. DMH has a tele-interpretation line that can be accessed in order to get real-time interpretive services. So yeah, and we can put more information. I'll add that to the slide so that when you access these slides, you'll have that information as well. And thanks, Louisa.
Can you give a further description of the role of a resource coordinator?
Sure. So the resource coordinators work at DMH, and they are they're basically responsible for like triage. Like they see the cases that come into the portal, and some of those cases just need like a quick check-in, and some of them might need additional conversation and help to figure out what the problem is or what the right service match would be. Some of them haven't signed the consent form yet and need the process explained to them. But the resource coordinator then would decide whether they could meet the family's need by working with them to get a list of services, or whether the youth needs the attention of interagency partners. And the kind of case that needs the attention of interagency partners, and in my routing metaphor, I think of like the express lanes, to this is a kid who needs an alternative educational environment or residential treatment setting. And those cases go to the interagency team, but the resource coordinator is involved with that team and would know, like, okay, I can handle this stuff myself. This is outpatient service, community-based services, or, oh, this is residential services and it needs to go to a clinical specialist, to the interagency team. So the resource coordinator is kind of the first contact, and the person who does triage and routes things, like the traffic directors.
All right, next question. Is there a specific consent form parents need to complete to be able to enter their information into Beacon, and where is it located?
So the consent form lives in the Beacon system. In our old version of the portal, we had it as a paper consent form, and we would send it out to families, and then they had to send it back to us. But now they can give consent in the system, and the consent is recorded there. So if you want to see it, why don't I just make a list of the things that you all would like to see? So the slides, the consent form, the DMH teleinterpretation line, and I will make sure that all of these things go together wherever these slides are going. If the slides are going to live on our CVHDI website, I'll make sure this other stuff is there. It'll be a packet of materials, and then we'll make sure you have it.
Awesome. Next question. The link to 211 takes you to a page that no longer exists.
Well, that's helpful to know. Let me just say that 211 is not operational all over the state. 211 covers some parts of our state and doesn't cover other parts of our state. Some states have implemented 211 statewide, but Illinois has not implemented 211 statewide. I have heard conversations and interest about implementing 211 statewide. But that could be why you are getting that message if you are in an area that is just where 211 has not been implemented. That's why there's a list of like 6 or 7 different options, because some communities have IRIS, some communities have 211. Spider covers every place. So it might be your best bet to start. But we're noting everything you're saying today. So if you're getting an error message, we will go in and figure out why you're getting an error message. So thank you. And by the way, in Beacon, there's also a place for you to give feedback about Beacon. And the portal manager, also staffed at DMH, her name is Kimberly, and she keeps track of every complaint, comment, suggestion, piece of feedback, and she works with the people who maintain Beacon. So there are lots of opportunities, and we welcome your input and critique or compliments or whatever you want to give us about Beacon. We want to hear it.
I think I know of course I know the answer, but I'll let you speak to this. Is there a flyer or something we can send to families to explain Beacon?
Yeah, I mentioned we have a flyer. We can provide you with that. I'll put that on the list of things that you all need. We have a flyer, but we're working on a family-friendly brochure. And by the way, to the last participant, they are correcting the 211 link as we speak. So it's underway. They know it's messed up. And thank you for flagging it. So we'll make sure you get the flyer also and the brochure when it comes out. And Natalie, who's moderating, and Jackie are our 2 communications partners from ISBE, and we meet with them all the time. So they will also make sure that they're hearing your concerns today, and they'll make sure that all the information gets where it needs to go.
Absolutely. Next question. Is this only for families without private insurance?
So I think we talked about this as well. If you have private insurance, you can use Beacon, but you will also be directed to consult your insurance company's network, because we don't want to we want to make sure to leverage the resources that are available to families. If they're covered by insurance, they might choose to see a provider in their own network and should use those search tools, but they can also use Beacon.
Is there a way to explore Beacon without acting as a family with a need? For example, for school counselors to be able to explore and gather information to share with families?
Yes, you can do so by going to Beacon and using it anonymously and clicking on Spider or the other search tools. The resources that will be a little bit harder to peruse will be the state-funded programs like the ones I mentioned in the 2 vignettes, things like the Family Support Program or Pathways or CCBYS. You might have a harder time. Those are really running on this eligibility algorithm where if we hear certain things, we're like, oh, this kid is really a good fit for this program. You won't get that kind of matching, but you can look, you will be able to look around, yes.
Okay, I just browsed the site and the locator brought me to Downstate Resources and I included a Chicago zip code. Has someone piloted this already?
Yes, people are testing this all the time, and that sounds like a Spider problem. So did you put that zip code in Spider? I don't know. I don't know how to, I can't communicate directly with people. Thank you for, sorry, I'm not used to this modality. Thanks for flagging that. And Louisa, who's on the line, is noting all these things, as am I, and we will make sure to figure out what's going on. But yeah, we test it all the time, and we usually detect when any little thing is wrong and try to, escalate the priority of fixing it. So I don't have an update on that particular glitch, but we will go in and check it out.
What is the plan to get more mental health resources in rural areas?
I'm going to tackle that question, but I want to say one thing to the previous participant, which is these glitches that you're noting, this is exactly why we released it in a slow phased approach and didn't put it out to families. And exactly why you have 2 months to find as many problems as you can. And I hope you don't find any, but we want you guys to kick the tires and see what works and what doesn't work, because we couldn't possibly come up with all the infinite permutations of things to make sure we find everything. So please let us know if you don't like throw up your hands and say, oh, this thing doesn't work. Like, this is the reason why we're rolling it out to you, so that you'll let us know if things aren't working. So thank you. Okay, the plan for developing more resources downstate. So that's kind of a longer story. But what I will say is, if you haven't seen the blueprint, Appendix C in the blueprint details our efforts to conduct gap analysis to understand what areas in our state need to be prioritized for service development. And we're using the data on how many people need services and what services are available to identify where those gaps are. Some of those gaps are going to be filled by actually developing like brick and mortar services. Some of them will be filled by leveraging technology and telehealth, although we have some issues we need to figure out with telehealth. But we are working on prioritizing underserved areas. And you might be interested to look at the maps that are in the blueprint, which illustrate some of the areas that should be the highest priority, because it's not just all of downstate. There's actually, we did maps that are like red to blue, not politically, but depending on how big of a service gap there is. So I'd be interested to see if those resonate with you.
All right, I'm just going to update you, Dana, that the question you just answered, the person responded that yes, that was their question, and yes, it was in Spider, and thanks.
Okay, great.
All right, final question. Do you coordinate with the Illinois Department of Rehabilitation Services?
So the departments that we've been working with are the 6 that I mentioned, but as I said, I've been meeting with leaders from some of the other adjacent agencies about developing a more like of a lifespan approach to meeting behavioral health service needs. And that would include rehabilitation services and Veterans Affairs and aging, all of the other agencies that serve people. One thing I will say is that the Department of Public Health, which is concerned with everyone and applying a public health lens to behavioral health issues, just announced last week that with a new kind of seat for children's behavioral health at IDPH. And so I'm really excited to see what opportunities that brings to be able to kind of zoom out and apply a public health lens to behavioral health as a problem we are all facing, and allow us to kind of partner even more broadly than we have. Thank you for the question, and thank you all for spending so much time with me today and for raising so many good ideas and thoughts and questions.
Okay.
Any closing words, Superintendent?
Nope, just I want to appreciate everybody's time, and we have another one of these tomorrow for any of your colleagues that have not signed up. We still have another one available, so please encourage your colleagues across the state of Illinois to join and learn more about Beacon. And again, thank you for your time. Enjoy your Halloween.
Happy Halloween, everyone.
Thank you.